Yes, thank you very much, Gordon. Thanks for this nice introduction. And thank you also to you and to the conference organizers for inviting me to present today. It's a really, it's a pleasure and one of the wonders of our post-COVID society that we can so easily have these online conferences, which really give us the opportunity to share knowledge easily across the globe. So delighted to be here today with you all and to take you through some of our latest developments from the epidemiology group at KIT in Amsterdam, and most specifically the development of our bridge guidelines for good epidemiological practice in global health. And as such, I'm giving you an international perspective to issues of ethics, integrity, and fairness in research. So I'd like to start the presentation with what we've come to describe as the tale of rats and mosquitoes from our bridge collaborator, Dr. Susan Rumisha in Tanzania. Early on in her career, she visited communities in rural parts of her home country, Tanzania, to introduce communities to her malaria research that she was planning to conduct in these communities. And as was the custom and the norm, she spoke to village leaders to inform them about her study and what her group was planning, and answering any questions that they may have about her very important research. And the village leaders listened very carefully, and then they politely replied, thank you so much for this, but you know what? We don't have a malaria problem here, so we don't need your research, thank you. Actually, we have a rat problem. This is a pest. It's everywhere. They nibble at our feet, and whenever our children are playing, they're like rats everywhere. So can you please change your research, and can you please research rats instead of mosquitoes? That would be very much appreciated. And she was completely flabbergasted, but also early on in her career, learned a very important lesson, because especially the way then they put it at the end was like, first help us with our rat problem, and then we will help you with your malaria problem. So she understood that the importance of actually having research that is responsive to local needs is the most important thing to consider when doing your research. And so this interaction for us is one we refer to often because it's so emblematic of knowledge production in global health, and it touches upon very important, crucial questions when we prepare research and when we consider research in global health. Like, what is good science? What makes good science? And who decides what is good science? Who decides what is worth studying? And ultimately, whom are we conducting research for? So hopefully throughout this presentation, you will also see how these type of questions have shaped the bridge guidelines, and how with these guidelines we try to really put these type of reflections at the core of a research process. So there's two important components here, two important concepts that we need to touch upon before getting into exactly what the bridge guidelines are. And it's the concept of research integrity on one side and research fairness on the other. So let me start with research integrity. I guess many of you know about this also because it's the topic at the moment, especially and COVID has shown really the importance of integrity in the scientific endeavor. But research integrity refers to all the procedures that we have in place to guard science from ill-designed, badly implemented, inappropriately analyzed, or selectively reported studies, because these will lead to irreproducible results. And here a little bit the hashtag that we can think of is research waste. All this waste of research, this waste of public money, this waste of people's time, these wasted opportunities due to bad research in a few words. And so here, when it comes to at least our field, the field of epidemiology, when it comes to the specific context of the Netherlands, we have a number of codes that have been developed. We have, well, in the Netherlands Codes of Research Integrity. We have also the European Code for the Conduct of Research Integrity, and I'm sure there's similar ones also in your respective countries, and in Australia, there must be similar ones. And when it comes more specifically to then epidemiology, this is translated also into guidelines to support epidemiologists. So there's the very famous STROBE guidelines, strengthening the reporting of observational studies in epidemiology. And then different epidemiological organizations across the world have then also developed guidelines specifically for the epidemiologists in their countries. So in the Netherlands, we have the Responsible Epidemiological Research Practice guidelines. So these are all examples. We have codes and guidelines that are particularly focused on research integrity. But so my field of research, and probably a few of you attending this conference, is global health. And in global health, of course, research integrity is important, but so is equally as important research fairness. And what do I mean here by research fairness? I mean all the realization, the movement that realizes that there are power imbalances in global health, and that these need to be acknowledged and then redressed in order to maximize the positive impact of global health research, both on local researchers and local communities. So research fairness, over the past years has really come to align itself with the movement of decolonizing global health, because it's really about putting the center of power back where it should be, which is where the research is conducted and where the communities live. And so here also there's a number of guidelines that can support researchers in global health that are very important. We have the Global Code of Conduct for Research in Resource-Poor Settings, and that's the Trust initiative. There are some guidelines developed by a Swiss group called the Guide for Transboundary Research Partnerships and the 11 Principles. And then there's the Research Fairness Initiative, which also provides guidance, especially at institutional level, for researchers and research groups. So these are two very important movements and initiatives which are very relevant for global health research. But what we have found is that actually it's difficult to literally bridge between these two. Because as you see, there's guidelines for one, there's guidelines for the other. But how, in reality, we've noticed that there can sometimes be a little bit of a tension between one and the other. And which one is the priority? How do we navigate these tensions? How do we navigate the difficult decisions about, in this particular moment, should I worry more about integrity, about fairness? What is the right thing to do? I want good science. What is good science? Is it, following all of these precepts, or should I give priority to these? And so the bridge guidelines really emerged and were developed in an attempt, to bridge between the two, to acknowledge that there is a tension sometimes, but that you need to go towards the tension. You need to understand that tension, and also through dialogue between different stakeholders within the research project, and also sometimes beyond the research project, try to understand what is the best thing in that particular moment and how to navigate these dilemmas. Maybe just a few more slides about integrity and fairness. A nice definition I find is the one of research integrity, is the one from the World Conferences on Research Integrity, which you can find on this website. It's defined as the principles and standards to ensure the validity and trustworthiness of research. So these are like the two really key words: validity and trustworthiness. And there's different principles, and again, different documents, different initiatives, different associations may come up with different ones. This is one from the EU, which identifies 4 fundamental principles for research integrity. So we have reliability, honesty, respect, and accountability. So reliability is about ensuring that we really have high quality research with the right design, the right methodology and analysis strategies. Respect is the respect for colleagues, research participants, society, ecosystems, and cultural heritage. Honesty is about developing, undertaking, and reviewing reporting in a fair and full and unbiased way. And accountability is really about being accountable for the research from in every single stage of its production, from the idea to the publication and all the steps in between. So you see, research integrity per se does actually encompass many components of research fairness, which we talked, because it's actually about respect and it's about honesty. Certainly a broadly encompassing concept of research integrity should also really fully also encompass research fairness ideas. And what do I mean by research fairness ideas? Well, here I'd like to refer to this visualization and the reference from the Research Fairness Initiative. So there's also the website here. And so the motivation for this fairness initiative is that it's an acknowledgement that there are systematically unfair outcomes between partners in a research project in global health, and specifically in regards to their ability to shape the research agenda in their countries and to reap scientific rewards. And in practice, what happens is that the wealthiest and best equipped institutions have a competitive advantage in the scientific arena, which leads to the question, what will be the ultimate impact on the local populations? Why is this research in a particular country being conducted by other people in other countries? And what is the ultimate goal of conducting that research? Is it really to improve the health of local populations? And sometimes it may be the goal, but it's not really realized because of all of these problems in the setup of the research partnerships. So this was a bit of background to introduce really the bridge guidelines and how we tried to put together integrity and fairness principles, specifically focusing on epidemiological practice, because we're epidemiologists. And for us, it was really important that we were able to conduct our epidemiological studies with integrity and fairness. And this actually evolved from many years of teaching at KIT. So at KIT, we have a master's in public health. It's been running for about 70 years, I believe. And we have a course on epidemiology and statistics, which I currently coordinate. And we realized in our course that keeping up with time, we had to start teaching research integrity, of course, to our students. But we really realized soon that research integrity wasn't quite enough to prepare our global health students to conducting research in the real world, in their real world. We realized that there were so many other things that were important for them to consider. And so, it began as teaching material, it became a compendium for students, and then slowly the momentum grew also with some of our research partners to actually formalize this type of thinking into some guidelines. So if you're interested in the guidelines, there we have two publications, which actually came out 2 years ago, I believe now, in BMJ Global Health. So we have the main publication, which is the one that you see on the left, which describes the development, the rationale and the development of these guidelines. And then we have a smaller, an accompanying paper, which has explanation and elaboration. So then for each of the items in the guidelines, we have further, as the title says, explanations and elaborations. And this is then we found then very useful for teaching. So this is, we rely on it still for our teaching epidemiology and statistics at KIT. So maybe a little bit more about the development of these guidelines. So there were some, some ideas, some draft concepts. There was a compendium for students, which was quite evidence-based, because it had been, this compendium had been developed using all the latest research that we were able to access on the different topics. And this gave us a first draft of potential guidelines. And then this enabled us to then embark on a Delphi consultation study. So this is the type of methodology that is, I think, standard by now for the development of guidelines. And with the Delphi approach is a way to get feedback and various iterations of feedback from a group of experts on a certain topic. So we conducted an e-Delphi study. So electronic Delphi study, which means that it was virtually all an online exercise. So the way it worked is that we had a survey monkey, which we sent to a broad range of stakeholders that we identified within our network, and we asked each of these experts to comment on the draft guidelines that we had developed, and which was our student compendium. And that gave us a first round of feedback, and we processed this feedback, and that was and after that we were able to then send a second round of Delphi SurveyMonkey questionnaires to the same experts, and we got then further comments, and also it enabled us to reach a little bit consensus among all the stakeholders involved. And then there were still a few items that were a little bit thorny, so to speak. And therefore, to resolve those, we then selected 8 experts from our whole group of experts. And we invited them to a workshop in Amsterdam. And then we had in-depth discussions for each of the items and took some decisions among this group of 8 experts on what would be the final items in the guidelines. And then this final set of guidelines was again sent to all the stakeholders. So this gives you a little bit of an idea of who participated in this Delphi program. So in this Delphi exercise, you see the participants by country. It's about a third were from Europe. I guess being also an institute based in the Netherlands, we have a strong Dutch and European network. We were really happy to also have input from the Americas, both North and South America, from our African partners, where we actually have many, because a lot of our research in Africa, and then partners in Asia were also able to provide some feedback. And I think we had one respondent from Australia. That was not a lot, but still we were very grateful to have had that input. And then on the other bar chart, you see a little bit the breakdown of the types of profiles that we had in our Delphi study. And I think we had about 40 people who responded in both rounds of Delphi consultation via SurveyMonkey. And so out of these 40 people, the vast majority, as you can see from the bar at the bottom, worked in universities or other academic research institutes. We had some representatives of funding organizations, also from national public health institutes, NGOs. We also had a few people from consultancy firms or knowledge institutes. I think we had 2 or 3 from pharmaceutical companies, and we were happy to have those views because, of course, good clinical practice is very much the norm in clinical trials, and so we thought we were happy to be able to learn also from clinical trial scientists involved in clinical trials, how to learn from their experience using these types of guidelines. And then we had one journal reviewer also participating. So this gives you an idea that we had quite a broad representation of stakeholders. And then out of the 8 that came to Amsterdam, we also tried to have a geographical diversity and also diversity in profiles. So what came out of it? We have the bridge standards and criteria. So we actually have 6 standards that cover the 6 steps in the implementation of an epidemiological study. And it's represented here. First step, study preparation. Second, protocol development. Third, data collection, data management, analysis, dissemination, and communication. And one of the criticisms we get, of course, is that it's not always so linear, and that also there's actually a loop, of course, that happens because one study, so step 6, then informs the next study, and is therefore more linked to one. And it's not such a linear process, and there are feedback loops in between. And that's true, and we acknowledge that. So we wanted to simplify it, to provide guidance. But we using the guidelines in our own studies, we do realize we have to skip from one to the other and then go back. But yeah, we don't. It's not necessarily a problem as long as you're aware of it. And so the way the guidelines are shaped is that there is a standard for each step. So we have 6 standards, and then for each standard there's criteria. And the criteria are really the checklist item that help you to assess whether you have reached the overall standard. So the guidelines are very much, a checklist, but it's not necessarily a checklist where you have to tick. And it's not all about ticking. It's more about the thought. Did you think about this? And then you can just say, yeah, I thought about it. And then it's up to the researcher to decide whether, they decided to do something about it or not. But it's really more like a checklist in the sense that it reminds you of the different things that are important at different steps. I want to give you a taste for these guidelines, and but I don't want to bore you by taking you through each and every criterion. And therefore, I would like to instead present to you 3 scenarios, which are typical of the ones that we encounter in global health epidemiology, and also where the guidelines can help us. The first scenario is one related to data management and issues getting the data that you actually want out of the data collection exercise. The second one is about mixed methods research and trying to get the most out of the combination of quantitative and qualitative analyses. And then the third scenario is about dissemination. And just to make it a little bit more concrete, let's look at some, fictitious but also easily relatable study in a fictitious country. Let's just pick this fictitious country of Perukistan, and imagine that they have a COVID-19 prevention study. Let's imagine it's a multidisciplinary research project, and they want to compare the prevalence and effectiveness of prevention measures against COVID-19. And it's a collaboration between a global North and a global South institute. So, first scenario, we have these researchers doing this research on COVID-19. They spend 2 months collecting data using electronic data capture for a quantitative survey. So imagine they're using, Open Data Kit, ODK. They went to different households, collected different sorts of data. It was a lot of work. And during data analysis, they actually find out that there's issues with the formatting of various variables. There's a lot of rubbish, to just put it bluntly. And they have to take a very painful decision to discard nearly half of their data. So if you've conducted an epidemiological study, this has either happened to you or it's your worst nightmare. So how can the guidelines prevent this from happening? Well, here's a little taste for it. We have standard 3. Standard 3 is about data collection. And the standard says use valid and reliable instruments and reproducible methods while ensuring culturally appropriate procedures. So already in this standard, you see how we're trying to combine the integrity and the fairness component, because we're saying we need valid and reliable instruments, reproducibility is key. So in that sense, we're really in line with all of the research integrity principles, but at the same time, we're very aware of the cultural appropriateness of the procedures, and really having something that is locally tailored and hopefully also locally developed. So that's the standard, and the standard has different criteria. And the one that is relevant to this particular scenario that we're talking about now, of the rubbish data, is criteria 3.5. So here 3.5 says pilot test, and if possible, field test all research instruments prior to the start of effective data collection. So this is a reminder, essentially, to researchers that when they're preparing their data collection, they should not forget to pilot test and field test. And of course, more we know also from follow-up research that we've done that these are things that more senior researchers usually, are very aware of and do and prioritize, probably also because of lived experience. But we also find that these are things that sometimes more junior researchers are not always aware of and may not always have the right tools to do. So in that sense, it's especially a good reminder for junior researchers, and it's a reminder also that can help, for example, a discussion between a mentor and a mentee. And so, yeah, hopefully one could only hope that had the tool for this COVID-19 study been properly piloted and field tested, these errors would have been picked, and then the researchers would not have needed to discard half of their data. There's other relevant criteria related to this type of research waste, you could say, in Standard 4. Standard 4 is about data management, and the standard is manage data with reproducible procedures and ensure compliance with relevant data protection rules. So here also, the reproducibility component is key, and we have different criteria related to having a good data management plan, pre-testing your data entry application, and describing all the variables in the codebook. And all of these things, if done properly and if done ahead of data collection, which is actually the recommendation here, can really help you ensure that you have a valid tool, and that once you really go live with your study, you have good data, and you can minimize the chance of these, unfortunate events happening, whereby you end up with data that you cannot use because it's simply not good enough for your research. So again, it's not groundbreaking, but it's important to remember to do this and to do it at the right time. Okay, the second scenario. Imagine the study on COVID-19 was actually a multidisciplinary study. And so they aimed to address the uptake of various prevention methods, for example, the use of masks and hand washing and all of that, so preventive methods for COVID-19, and they used quantitative data for this. But imagine they also wanted to look at reasons for the uptake of these measures, while their qualitative data would be better. So focus group discussions, why you're not wearing the masks and what's not working, and how about hand washing and all of that. We know that qualitative data is a lot better to get this type of information. So let us imagine these researchers had these two research streams going on, the quantitative and the qualitative. They did all their data collection, but actually when writing the report, the researchers realized that they cannot reconcile the quantitative and the qualitative information. So they have like two parallel studies, and actually there is no coherent story. They cannot put it together. They cannot, and we say sometimes, when you mixing the quant and the qual, this is where the magic happens. This is where we understand everything from different perspectives. But the reality is often this doesn't happen. In theory, this is where the magic should happen, but in practice, it doesn't, because we didn't really design the studies to be interconnected enough. We actually designed two parallel studies. Again, this is something that we know also from bitter experience. And the bridge criteria, guidelines also help guard against this. And this is in the first standard. So the first standard is about study preparation. It is a standard which states that one should carefully prepare the study in partnership with local researchers by taking into account existing knowledge and resources and engaging with key stakeholders. And here, there's again different criteria. One of the criteria is select study design and research methods to best fulfill the study objectives and give due consideration to multidisciplinary approaches. So you see the multidisciplinary approaches and the thinking about, what is my research question and what type of methods do I need comes in very early already in the study preparation. But it also comes again in standard 2, which is about protocol development. And in standard 2, we have a criterion that tells us that when conducting multidisciplinary research, we should describe the purpose and strategies to integrate different analytical methods. And so already we guard ourselves from this issue of having two parallel studies, essentially, by already in the protocol, this thinking beforehand, okay, why do I have these two components, and what is the aim, and how can I ensure that they're really speaking to each other? And then finally, we have standard 5, which is about data analysis. And standard, there's also a criterion related to multidisciplinary research, and which really encourages during analysis to integrate whatever quantitative analysis with other analysis in an iterative process, because that's also often what is needed. The different rounds of discussions between the different teams to really understand how things fit together. So hopefully, we hope that with these criteria, we can make the most out of our interdisciplinary and multidisciplinary research projects, also acknowledging that mostly to solve these complex problems in global health, we do need more than one method to understand the complexity of the problem. But in order to conduct this type of multidisciplinary research well, we do need to think explicitly about our strategies already starting from study preparation and protocol development all the way to data analysis. Now, the last scenario, maybe another one that you can recognize yourselves in, or situations. Certainly it has happened to us at KIT. Upon study completion, we organize workshops to share results with stakeholders and ministries of health and NGOs to really share the results of our research and to see what the implications are for practice. And I can only imagine that these COVID-19 researchers in Perukistan would do the same, and they might be confronted with this typical issue that in the end, very few of the key stakeholders attend the workshop. So they've done all this work, they've done all this great research, they have great insights, but kind of nobody cares. And what next? What then? It really feels like there's such a missed opportunity for impact based on research when we fail to garner interest from the key stakeholders. So how can the Bridge guidelines preempt these type of situations? Again, there's some criteria in Standard 1 about study preparation, which invite researchers to identify and engage key stakeholders already from study preparation. So you don't just try to scramble to find your key stakeholders at the end when you're disseminating the results, but rather you identify and engage them at the very beginning. And they are part of also defining the research gap, defining the research needs, and developing the study. And then, of course, they need different stakeholders. We need different methods to engage different types of stakeholders, also depending on their needs, depending on their competencies, depending on their expectations. So, inviting them to a presentation might not, where we present things in a very academic way, might not always be the way to engage certain stakeholders. We may need other methods because of their competencies. And so we need to be very, very aware of that. And yeah, key stakeholders, there's many of them, but we believe it should include, at the very least, the affected populations and then the end users of research. So who are you doing this research for? What type of decisions do you expect to be made on this? Well, and who makes these decisions? And these people you should involve from the very beginning. And then we have criteria related to dissemination also at the end of the research process with Standard 6. Standard 6 is about dissemination and communication, and it states, it encourages researchers to report and disseminate results, preferably in the public domain, with means of communication which appropriately target key stakeholders. And so here the very first criterion is about developing user-specific dissemination and communication plans in consultation with the key stakeholders. So, of course, as researchers, we're very interested in academic publications, but this is often not the best way to disseminate our results to non-academics. And typically the end users, people who need to make decisions based on our results, they need something else. And this something else depends really on what they say that they want. And so we need to engage them from the very beginning to try and understand what they will need. And we need to work with them to develop these types of products that they will need. So this was hopefully a useful overview of how the guidelines can help with a real life scenario. Maybe a few slides to conclude. Hopefully you will have seen how the Bridge guidelines aim to ensure high quality studies. So it's about good science, but it's also about a positive impact on local research systems and people whose lives we want to improve. And at KIT, we've tried to embed the Bridge guidelines within our research ethics committee procedures. So we've embedded selected Bridge criteria in the REC form, so especially things about having data management plans, having quality assurance plans, having dissemination plans. We had a meeting with REC members where we really identified the different criteria that we wanted to have in our REC procedures. And also, as a REC, I'm actually a co-chair of the REC since last year, we also encourage the use of the Bridge guidelines during the implementation of a study. Yeah, maybe for those of you who want to learn a little bit more about Bridge, we have a website, thebridgestatement.org, and there you will find the guidelines. Then we also have an Excel checklist which also enables researchers to take notes, because as I said earlier, the Bridge guidelines are not so much about ticking things, but it's also the thinking process that goes around it, and that goes around the decisions to do something or not do something. And so the checklist in Excel also has like a lot of text boxes for people to just document their decisions, and we have developed them in English but also translated them in French, Spanish, and Swahili. And we have different booklets also that you can access, and a nice video also recently. And so hopefully you will have gotten a bit of a feeling for how this Bridge guidelines can help us conduct the right research in the right context. And so study mosquitoes if we have to, and malaria if that is what we should do, but also rats if that is what is needed in that particular time and moment. And maybe one thing to say about our next steps. We actually recently completed a research integrity and research fairness survey, where we tried to look in a sample of global health researchers, both in the global north and the global south, to what extent these criteria are common practice nowadays within global health researchers. And we're also using the guidelines to develop a coaching program, because we see that actually, we saw actually also from our survey that more senior researchers actually score usually better on all of these criteria. And there's probably there also a good opportunity for like mentoring and coaching also within teams, and from cross-learning and learning from each other. And so we're working on developing this type of program around the guidelines. And that was it for me. If you want to discuss this more, if anything sparked your interest, feel free to reach out to me via email. My email address is on the screen. So
Sandra,
thank you so much for your attention.
Yeah, thank you so much for that, Sandra. And of course, because we met in June and this is now November, I now realize why I wanted this audience to hear this talk, because I think there are so many synergies between what we do on ethics committees and using your guidelines. So, for example, in Australia, we have our national statement, which is our guidelines for ethics. But I note that these days, and in fact, in my own institute, we some of our third-party providers have had a data breach. You know, the management of data is so important, and I really like this because it puts data management at the forefront, but also helps the individual to consider data management as they go along. So I think it's very relevant for ethics committees. So let me ask you firstly, how have your ethics committees used it, and what has the feedback been in relation to this?
Yeah, so as I said earlier, we have a research ethics committee at KIT, which reviews all the research that is conducted by KIT researchers. Although we do have a decision tree, and some research then gets reviewed also or made only locally in the country where the research is conducted. But we do have the KIT Research Ethics Committee, and there we really tried to identify those bridge criteria that are related to planning, especially, and we embedded those in the questions in our REC form. So we have a form, like I'm sure all RECs have, with different questions regarding, how it's essentially the protocol, right? What are you planning for this research?
Sure,
because
yeah.
As a REC, you just need to give a go ahead. And so many of the criteria related to the planning have ended up in our REC form. So that was our way, and we. It's going well so far. As a REC reviewer, I look at these forms, and researchers are filling them in, and it's giving us a bit of an idea of their plans. Of course, then the question is, and maybe that's a challenge for more RECs, that what is then actually done in practice, and that is something that we're still trying to work on. Because it's nice to have all these plans, but then what are you actually doing? That's still a challenge for us.
And that's a great answer, and I can really see the value of them, because in actual fact, it seems they could be applicable not just to epidemiological research, but in actual fact to quite a lot of other sort of research. Sandra, one of the other sessions at this conference is about the value of lived experience. And I know during the development of the guidelines, you might say that they were developed by people with lived experience because 90% of academics who do epidemiology, do that. But I also really liked the point you made when you're doing your pilot testing on your target population, or rather you're identifying the key stakeholders before your dissemination, and you're bringing them along with you on the journey. So in actual fact, you actually combine, if I'm correct, you actually combine that target audience lived experience with what you're trying to achieve. So can I just ask then, what sort of feedback have you had from the kind of target groups you may have used these guidelines on about the applicability and the approach?
Yeah, so the most of the feedback we get, of course, is from researchers, right? Because and that you're not actually going to a stakeholder, you're not going to a director of I don't know, TB program or whatever with your guidelines and saying, I'm talking to you now and trying to understand your needs because I'm following the bridge guidelines. So that type of feedback directly from the stakeholders we don't have, but we do get feedback from people who have used the guidelines, from researchers. And that's a nice thing about this data collection, the checklist that we have, and that people can fill in their thoughts. And then we often ask people to, we have a number of people who have then send us these forms back. So we can see a little bit how that went. But we so far, the type of feedback we've had from researchers is that they've been really happy that the guidelines kind of forced them, so to speak, to go out and speak to stakeholders earlier on. And so we had an example from a researcher in India, for example, who said, my PhD research now is completely different. And what she was saying, it's laughing. She said, I've really adjusted my questions because actually I realized, the people in the district health management team, their issues were also this, and this. And so I've added that. And, they gave me some good directions about how to go about it. So the feedback we're getting from researchers, it's that they really appreciate this being nudged in that direction. Because I also think as researchers, it's maybe not our comfort. So it's a bit outside of our comfort zone to go out and speak to people and speak to, maybe different types of stakeholders who are not researchers. But the feedback we get is that it's usually a good idea. It makes for more relevant research, and a research that's more responsive to the actual needs, and people know that then they're going to benefit from it at the end because their research will be more useful.
So one final question, Sandra, noting the time we're on. I know there was only one Australian respondent in your group, and I must say I took the guidelines when I came back from South Africa, and I gave them to all of my research integrity advisors in the institute, and they really liked them. But can I ask, do you know what the uptake of these guidelines is globally? You did talk about global north and global south, but I won't go into that. But do you have any idea about the uptake of these guidelines outside Europe?
No, actually, I don't. It's a very good question. Yeah. Of course, we look at the statistics because you can see how, on the publication, how often it's being downloaded. I wonder if we could also see from which countries. No, and part of our plans also with this coaching program is to also create more of a community of users with also type of a cascading effect. And I think maybe once that is up and rolling, we'll have a better idea of where it's being picked up more. But at the moment, no, I don't know, but you're making me very, very curious, actually.
Well, Sandra, look, thanks you so much for your time. Of course, I know what time it will be in Amsterdam when this is shown, and I wouldn't want you to be awake at the time. But I really enjoyed the presentation because when I heard it for the first time, I thought this is really relevant, and especially for all of our ethics committees, and there are 230 of these in Australia. It's another standard by which we can actually judge, epidemiological and quantitative and qualitative research. So I hope it's been very beneficial for all of our audience. And audience, please please join me in thanking Dr. Sandra Alba for this wonderful presentation about the development of the Bridge Guidelines. And Sandra, thank you so much for your time, and good night.